I am TOREMIFENE, a drug affecting the reproductive system, and I am here to tell you something about myself. Let's start off with my drug names. I have 3 names, a generic name which is TOREMIFENE, a brand name which is Fariston, and a chemical name that is very complicated and difficult to pronounce. Next is my drug classifications. I am classified according to 2 things, my therapeutic and pharmacologic actions. For my therapeutic classification, I am classified as an anti-neoplastic because I act to prevent, inhibit, or halt the development of a neoplasm or a tumor. For my pharmacologic classification, I am classified as an anti-estrogen, also known as estrogen antagonists or estrogen blockers. For pregnancy category, I am under US FDA pregnancy category D, which means I can be used by pregnant women because potential benefits outweighs potential risks. Now let me tell you how I work, or my pharmacodynamics. I, TOREMIFENE, is generally used to treat patients who suffer breast cancer. I serve as an estrogen antagonist, usually in the breast. I bind to estrogen receptor site and cancer cells. I can help block the estrogen from going into the cancer cell. I will aid in the anti-tumor effect in the breast cancer, and it is because of my ability to compete with the estrogen for binding sites. I help the body block the estrogen from reaching the cancer cell, thus stopping the growth-stimulating effects of estrogen in the tumor. However, I do not destroy cancer cells. I only block the effect of estrogen in the breast tissue to alleviate the growth of the cancer. Let's now go to my pharmacokinetics. For absorption, I am directly absorbed by the body as I am ingested by the patient, and my absorption is not influenced by food. I am thoroughly absorbed by the GI tract. Distribution. I am then distributed to different organs of my target. In order for me to be delivered to those target organs, I bind extensively to serum proteins, mainly albumin. Metabolism. I will be metabolized by the liver, specifically to the hepatic, wherein I release anti-estrogenic effects to the body. When the anti-estrogenic effects are delivered to the body, the excess and not metabolized amount will now be excreted with the help of the biliary excretion and enterohepatic circulation through feces and a little amount through urine. My elimination from the body is processed gradually due to the enterohepatic circulation. For the next part, my fellow TOREMIFENE will tell you more about us TOREMIFENEs.
So hi guys, I am also a TOREMIFENE and I'm going to tackle about the indications, contraindications, side and adverse effects, and nursing responsibilities when you're going to take me. So for the indication, I am a drug that is intended and used as an estrogen antagonist that is used in treating the metastatic breast cancer usually happening in postmenopausal women with estrogen receptor positive or unknown tumors. So for the contraindications, I am a drug that is contraindicated to women who are pregnant or lactating because I am a drug that will give toxic effects to the body and it surely affects the fetus or neonate. To those patients who is diagnosed to have hyperkalemia, is also not intended to take me because I will increase the level of calcium in his or her body. Those patients who also have low levels of magnesium, potassium, and white blood cells are not advised to take me. The healthcare provider should also be cautious in giving me to the patient who shows allergies to me to avoid hypersensitivity reactions. When you are going to take me, I will give some side and adverse effects to your body or to your different systems in your body. So for the nervous system, the patient who will take me will have headache, dizziness, hot flashes, nausea, confusion, seizure, or depression. For the reproductive system, the patient may experience vaginal bleeding, pelvic pain, breast lumps, menstrual pain, and irregularities. For the integumentary system, the patient may have swelling in hands and feet, itching, skin discoloration, skin rash, dry skin, hair loss, and scaly skin. Constipation, loss of appetite, stomach pain, and difficulty in bowel movement are also visible to patients who take me. For the respiratory system, the patient may experience slow breathing or unpleasant breath odor. The patient may also have dark urine or difficulty in urination, swollen lymph nodes, muscle weakness, bone pain, metallic taste of the tongue, temporary blindness, and eye pain. So that's all for the side and adverse effects. Now let's go to the nursing responsibilities before I am going to be given to the patient, during the therapy, and after the medication. So first, let's tackle about the nursing responsibilities before. First, the nurse needs to assess the history data of the patient and check for the contraindications and causes, like allergies to any sex hormones to avoid hypersensitivity reactions. Also check if the patient is pregnant or lactating to prevent the fetus from getting the adverse effects that I will give to the client. Also, refer to the patient's history data to see if he or she has cardiovascular diseases, hepatic dysfunctions, asthma or epilepsy, and if he or she is using cigarette before giving me to avoid any side effects that he or she can get from taking me. The nurse also needs to have a physical assessment to create a baseline data that would serve as the nurse reference to evaluate if there are any adverse effects. The nurse also needs to monitor the result of the laboratory test conducted to the patient to see if it is needed to lower the dosage given or to recognize any alterations earlier. So that's all for the nursing responsibilities before I am going to be given to the patient. Let's go now to the nursing responsibilities during the therapy. First, the nurse needs to administer me as prescribed by the physician. This would prevent from side and adverse effects that I'm going to give to the patient. In case when the GI tract upset is present, administer me with food to relieve the GI upset of the patient. Second, give analgesics to the patient if he or she is having headache. If the patient is fond of smoking, the nurse needs to encourage the patient to stop smoking to decrease the risk of thromboemboli. To assist the patient with his or her nausea or vomiting, the nurse needs to tell the patient to only eat small amount when having meal. The nurse also monitor the patient's liver function when the patient is on long-term therapy to prevent the risk of hepatic dysfunction. The nurse also gives some support and encourage the patient to tell the nurse about how he or she is feeling for the patient to feel assured when dealing with the drug effects to his or her body. So we are here on the last part of the lecture, which is the nursing responsibilities after the medication. So first, the nurse needs to monitor for the patient response of the drug, adverse effects, and comfort measures done for the client, and evaluate for the effectiveness of the teaching plan for the nurse to identify if the patient really comprehend the lessons they've underwent while the patient was still on therapy.